So Christabelle is a doctoral student in the Department of Counseling, Psychology, and Human Services in the Prevention Science program and has graduate training in special education and school psychology. So please welcome Christabelle.
And the students can all head out, follow Matt, go upstairs. We'll come bring you guys back. And yeah, just as David said, after Christabelle, if Elias is still here, we'll have some time for you guys to all ask questions to the three speakers at once.
So start thinking of some good ideas, again, questions and potential solutions. So come on up.
Nice to see you. Nice to meet you.
Yeah.
Thank you all so much for being here. This is
So
so exciting.
too?
Oh, yes.
There you go.
Thank you very much. Okay, wow, this is the smallest clicker I've ever seen. Cool. Oh, this is not for.
Yeah, you can try and say
Ah. Is there a clicker?
yes.
Ah, great.
Got a lot of devices
Okay.
there.
Whew. All right, I am deviced up. So, good afternoon. My name is Christabelle Moore. I am here representing the University of Oregon. Go Ducks. Somebody threw me an O earlier. I was super excited to see that. I am here and I'm going to give you a brief, very quick and dirty overview of the research that we're doing at the university in different capacities. So I'm a prevention science doctoral student. It is a new program at the university. There's actually only 3 programs in the country. And prevention science is similar to public health, but in essence, we can apply this sort of framework to just about any health, behavior, or academic outcome. So in particular, I study suicide prevention, and I'm also interested in mindfulness. I was very excited to hear that come up. So just a moment. No? No? Oh, I think we got something. Yes. Okay. So again, very quickly, an overview. I'm going to first talk about my lab, not my lab, my advisor's lab, Dr. John Seeley, the lab that I work in. And then I'm going to talk about the collaboration with the Center for Digital Mental Health and the exciting work that's being done there. And then we'll do Q&A afterwards, like David said. So this is Dr. John Seeley. He is the lab director, and he has had, gosh, I think over 100 publications and I think 17, if I'm not mistaken, NIH grants, and has worked, his work has really focused on depression, prevention, and also suicide ideology. And so he's now working with the Alliance in Oregon, and Annette Marcus is here with us today. We work with her, and one of our big projects that I'm going to be talking about real quick is, there we go, is the statewide implementation of the Youth Suicide Intervention and Prevention Plan. And the reason, really quickly, that this is important work in Oregon, I know you guys are probably mostly from California, I'm guessing. I'm originally from California. I'm from LA, Dodger fan. And, but I am in Oregon. I've been in Oregon for many years now. And one of the reasons that it's so important that we study this is because Oregon has a much higher rate than the national average. And I think a recent statistic I saw was that it was like 42% higher. And so it's, but as you can see by this graph, and this only goes till 2012, so I'm not really sure exactly where we're at now, but the point here is that for some time, since the 80s, you can see that Oregon on average remains higher than the national average, and that's really of concern. So we have also, like California, we have a youth suicide intervention and prevention plan. And the work that the lab is doing is evaluating the implementation of this plan. So this has been going on since 2008, I believe. And then, 2012, Annette? Yep, and then our evaluation now is just kicking off. And so using an implementation framework, which I'll get to in a second, if I can get my slide to work. We're looking at the different, and I'm gonna skip past a few of these slides because I don't think that they're as relevant right now.
Yeah, I don't think the things were too worried.
Yeah, I don't think so either. Are you helping me out?
Yeah, no.
Oh, thank you. I'm like, okay, every third click works. I was picking up on a pattern. Well, I appreciate your help. Thank you. Can you go one more? Yay. Okay. And then I might have you go back. So just ignore all the small print here, but the idea is that, so our work in prevention science also looks at things from a much broader level. So when we're looking at how states, how districts implement, we're using this framework, which is an iterative cycle. And essentially what we do is we see how interventions are laid out, and then we work together with stakeholders and evaluate with on different committees essentially how it's looking, how it's working, using data sort of in this iterative fashion to continuously go back to the drawing board, reconfigure if needed, and see how things worked. And that's how we can really get good information on whether things get laid out, even though they're evidence-based practices in the literature. Once they're disseminated and implemented and rolled out, if you will, that doesn't necessarily mean that they're going to be applied in that same way. And that information can really help us out when we're thinking about rolling things out in other places, in other settings, in other states, with other populations, for example. So, okay, since this doesn't work, can you go, yep, perfect. So in the lab, we also have many other research projects going on in addition to this big evaluation that I mentioned. So specifically to social media, we are doing a literature review right now. There's actually not a comprehensive, not one, literature review that really is focused on social media exclusively based interventions for suicide prevention. So there's a smattering of different articles, but nothing that is really comprehensive. So we're working on that right now. And the preliminary results are sort of kind of a peek into what that's looking like at the moment, is that there's a lot of different kind of categories within suicide prevention and intervention work. And they're looking at different things. So there's the contagion that we've talked about already. There's the interventions, which are peer-to-peer. So right now, there's a huge need for this. And I think that this speaks to an issue with research and the tension between research and technology in general, and something I'm really fascinated by. Research is so much slower than technology. And so I was talking with someone earlier this morning, and it's almost laughable when it takes so long for us to publish. And it's like, once we get something published, it's like 2 years behind everything else. And then that's even if you can really get things published quickly. So there's certainly issues within the academic and our knowledge base that we have right now to work with. And so it's really exciting to have opportunities like this where we can have tech people and research people and community stakeholders all in the same room to really kind of share ideas with each other. And hopefully we can catch up with that someday, hopefully in our lifetime. And the other projects that we're doing are more about looking at what's out there for school implementation, rollout guides, the toolkits that are provided, and different communication plans that are available at the state level. So those are things that we think that'll improve upon the work that we're doing in the evaluation process. The next part of this is about the Center on Digital Mental Health. And this is Dr. Nick Allen, and he is the director. He's in the Department of Psychology. And first, I want to sort of orient you to the idea, and I think we can all get behind this idea that our handheld devices, our mobile devices, specifically smartphones, we have an opportunity to record so much and gather so much data on a variety of behaviors, and they sense things that we sometimes can get a better idea of as opposed to self-report. So when you ask somebody to self-report, traditional methods would be, fill out the survey, answer these questions. Well, what's really neat about smartphones, for example, is that they're able to record those things intuitively and sort of effortlessly, if you will, without having to rely on individual self-report. And these things can include things like language, where you are geographically speaking. Facial expressions is sort of the newest wave. We're starting to see that. Social interaction, sleep, physical activity. I don't know how many of y'all have trackers, Fitbits and Apple Watches and things like that. Our phones also do that too, depending on what phone you have. So there's all these different behaviors that our phones can track, and essentially these are all things that are related to mental health in one way, shape, or form. And so in the work that the center is doing, the idea here, if you center around, and this, I'm guessing the pointer doesn't work either, huh? All right, good old-fashioned pointing. So if you look at the smartphone, this is the device, and EARS is the acronym that this is given. Essentially, what this is showing is the potential for all of these different behaviors, music choices, geographic location, voice, text patterns, words, and also facial recognition is down here, along with activity, can all sort of be aggregated into the phone and then pushed up to a cloud. If you can go to the next one, please. And actually, one more. Perfect. And essentially what that does is that provides us an opportunity for intervention. And that's really where my background has focused on. It's psychology and education, and sort of the combination of those two. And the reason that this is so exciting is, so if you start here, here's an example case user. So here's any one of us, for example, or a student. Here's the phone. The information gets pushed up to the cloud. And then what that does is a series of things happens afterwards. So risk assessment is a traditional method that we use in schools right now. Sort of thinking along those lines of screening and thinking about who needs help when. One opportunity that the phones have is to be able to have geo-linked environmental information, which can then be sort of mapped on to different community-based resources, which are geographically close to or linked and around the person that needs the help. Then there are opportunities for algorithms to be built down here for intervention. So the idea is that there's multiple tiers of intervention. It's not just that everyone gets sort of a phone call or a text, but there's so much opportunity now that we have based on how these algorithms are built to go ahead and then provide different levels of intervention. For example, the first level being sort of these nudges or feedback to users. So that could be something, it's also called like a light touch. So a reminder about, let's say, mindfulness, or some other thing that's a very nice, kind of very easy and gentle approach to intervention. Very different from sitting down in a therapist's office, which are traditional sort of brick and mortar style psychology and psychiatry services typically are. This is different. This is going to be sort of that just-in-time intervention. Similarly, if it's something that needs an additional, depending on, let's say, the text, the sort of the words that this person is texting or using in whatever they're posting, or it could be the facial recognition software can then sort of track the affect of that individual. Then you have the opportunity for more sort of social network-based like sponsors. So this would be something like another student or a family member or another community member that already has permission from that student. And they have said, this person is sort of a safety person for me. So that person might be identified, then they could be sent a text message to say, hey, contact so-and-so, you know, and how are you doing? Check in with them. And then sort of another third level tiered approach would be then our traditional clinical services. This could be something where, you know, other community organizations are alerted to, or the school, the principal, the assistant principal, the mental health professional. So these are just visions. These are things that are hopefully will come to fruition soon, and with support from tech companies and collaboration with tech companies, and certainly there's funding needed. But I think this is a really neat opportunity that we have to move forward with this work. And really, next slide, please. That's all I have for now.